Welcome into the live desk. I am Janae Hancock. We have a lot of new updates coming into the KCTV 5 newsroom regarding the measles outbreak across the country. I want to start with this. Health and Human Services Secretary Robert F. Kennedy Jr. is now urging people to get the measles vaccine. So far, 3 deaths have been reported with this outbreak, 2 school-aged children in Texas and an adult in New Mexico, all unvaccinated. Today, 32 cases have been reported in the state of Kansas, and we just learned one person has been hospitalized. I am joined now by Dr. Janae Hancock with the University of Kansas Health System. Dr. Hancock, it is always a pleasure to have you here at the live desk with me. Let's start off with that latest update. The person has been hospitalized in Kansas. What do you know so far about that case?
Yeah, I don't think I know any more than you do. What I can say is we haven't had any hospitalizations or diagnosed cases here at the University of Kansas Health System. Although we've had potentials, we haven't diagnosed one. Certainly no hospitalizations. The only thing I can tell you is from basically what the public knows is that there has been a patient hospitalized, and that's kind of all I know about that and about the patient in Kansas that has been hospitalized. I don't have any further details.
And we'll be sure to let our viewers know as new details do come into the KCTV 5 newsroom. But I want to go back to the 32 cases confirmed in the state of Kansas as of today. Just your overall reaction to that. I mean, cases have been rising for the past 4 weeks.
Yeah. I mean, certainly for our communities, for our nation, when you have this disease, which is nearly completely preventable with the vaccine, the safe, effective vaccine. When you have this disease, when you have these hospitalizations, and unfortunately, the most profoundly sad, these tragic deaths of these young innocent souls, it is a horrible travesty and a tragedy, and it can be prevented. We have to continue to endorse the safety and effectiveness of this vaccine that has been used for 60 years or more. We know it can prevent these things. I can't imagine the profound sadness in these communities, in these families that have these deaths, which are completely preventable. And certainly my heart goes out to those communities and families.
A lot of people, Dr. Hawkinson, have been very outspoken regarding this outbreak, and we have been receiving a lot of questions here on our social media platforms and people calling into the station as well. So I want to bring you a few of those questions to make sure our viewers feel that their voices are being heard. Let's start off with the first one. One nearly saying that there are nearly 3 million people in the state of Kansas, but only 32 as of today have been infected so far. Why should people be concerned?
Yeah, I think this is for compassion for the dignity of life, compassion for our community, for our state, and really people around the nation. Yeah, that is a small number, that is for sure. But we know and understand that there are the most vulnerable around us, and those are the people that are unable to be vaccinated, maybe because they are not a year old yet. A year, 12 months is when we start the vaccination process. Now, you can get vaccinated prior to that, but in general, most of the children are vaccinated beginning at 1 year. So we know that there is that vulnerable population. We also know that in very rare instances, you can get the disease even if you've been vaccinated. But again, that is very rare. You also have to take into account the amount of people who are out there in our communities who are immune suppressed, who maybe not have full immune function despite being vaccinated. Maybe they're on chemotherapy. Maybe they've had a solid organ transplant. Maybe they're on other therapy for rheumatologic diseases. They can be at risk of this disease to some extent as well, and possibly those complications. So I think we have to keep our eye on our individual families and bubbles and circles and communities, but also more statewide and even national. You know, anytime you have to go to the hospital, for any disease, that can lead to complications. Now we know we've had 3 deaths. We cannot minimize those deaths. Those are individuals. Those are souls who were with loving families. So we cannot minimize, even though you just say, well, there's only 32 cases in a state of 3 million. We know the complications that can come along with this disease, both in the short term, but also in the long term. And of course, there always is the risk of mortality, and that can be prevented. And so we really want to try to do what we can, continue to battle misinformation, continue to endorse science and medicine, and really keep people, families, and our communities healthy.
And Dr. Hawkinson, this is not the first time that we have dealt with a measles outbreak here in the United States. What makes this one so different?
No, I think that's exactly right. Again, measles vaccine have been available since late 50s, early 60s. It's been used. It's been known to be safe and effective. We know that it was essentially eliminated for local spread in the United States in 2000. Since that time, of course, just as you said, we have had outbreaks. There have been groups who have been unimmunized and get the disease. Those numbers are quite small. Certainly we know in 2019 there was 1,200 cases of measles. A lot of those are dealing with international travel. But I think we are looking at a different nation right now. Obviously we had the pandemic. We know that with that there was a lack of access to care and maybe routine care such as vaccination. We know that there has been a mistrust of science and medicine and public health. We know that misinformation is abundant out there, and it is hard to combat all of that. So with all of those things combined, this is a different context now than it was in 2019. We have greater vaccine exemption rates across the board, even in Kansas, but across the nation as well. So this allows for a greater spread to occur than, say, even 2019, where we had 1,200 cases. But we are in general in a different context in our nation right now as far as science, medicine, vaccination rates than we were before. And I think that is one of the underlying problems with this outbreak and why it may take a little bit longer to help clamp down and reduce and really get over this outbreak.
And I did speak to a local mother on the phone not too long ago, and she just expressed that she is completely terrified right now. She just gave birth. Her baby is in fact 6 months old, so they're not old enough yet to get the vaccine. What do you say to expecting parents and new parents? How do you ease their concerns?
Yeah. I would continue with, being yourself vaccinated and your bubble vaccinated. That will help reduce the chance of spread. Obviously, we know, unfortunately, this virus can last in the air in an area, in a room, for up to 2 hours. So I think the concern is there. I will never advocate for being terrified, of course. But this is one other reason why we have to have compassion for the dignity of life. We know that there are those, as I spoke earlier, who are still at risk of this disease. And so it really is incumbent upon everybody within the community to try and get vaccinated so we can have that herd immunity or that population immunity. And the goal is for 95% vaccine coverage. That is really what it takes to really stop the spread of this disease. So there is a concern there. I think it is right to be concerned. Please keep in touch with your pediatrician, your medical provider. Certainly we know you can get an emergency dose beginning at 6 months of age. That may be a reasonable thing to do as well, but certainly talk with your healthcare providers, with your doctors about that.
And, as we talk about vaccines, going back to Robert F. Kennedy making that push to people, I should say, recommendation officially, publicly, for people to get the measles vaccine. Is that kind of a sigh of relief for you all as doctors, as you have been telling people for a very long time now to make sure that they are protected?
Yeah, I was trained in evidence-based medicine. That's the training here at University of Kansas Health System and many residencies and fellowships around the nation. We know that we have the evidence to support the overwhelming benefit of this vaccine. And I think it's incumbent upon anybody in public health, in medicine, whether that's a private institution or a public institution, to endorse the accuracies and the evidence behind all of these things as well. We are going to continue to do that, and that's kind of what we've been doing all along. That's all we can do, is continue to tell people the accurate information and understand also where people can go to get the accurate information. Certainly that is your local or state health department websites or even the CDC. But yes, we will continue to endorse the use of the vaccine because we know it has a great track record of safety and efficacy against the disease and, most importantly, the complications of the disease.
Final question for you, Dr. Hawkinson. I know no cases have been confirmed in Missouri as of yet, but it has been confirmed in surrounding states like Kansas, for instance. I know you guys are Kansas, University of Kansas Health System, but should Missourians be concerned at all?
I think everybody in the nation should be. I mean, if you look at the vaccination rates, and again, they go by kids who are entering kindergarten is typically how they get that information. The vaccination rates in general around the country are much lower than should be expected and much lower than we need for herd or population immunity. So I think really every community in the United States should be concerned about that and trying to endorse catch-up vaccination so that people can get vaccinated so you can help reduce the chance that this disease spreads through your community. And again, as we've talked about, affects those that are most vulnerable and don't have the ability to make the choice for themselves or even too young to get vaccinated. So I think that is a very important question. We know that diseases really don't care about borders. We know that they can spread very easily, especially this disease, like I said and I mentioned, can linger in an area, in a room, for up to 2 hours after somebody with measles is there expressing it into the air. So you may walk through an area an hour later after somebody had been there, and you may get infected. Certainly we know it is highly infectious, and this is why there's such a concern when people are going through airports especially. We've seen a lot of reports about exposures in airports, and that is why. So, but yes, I think every community in the nation should be concerned. You know, it starts with you and your family protecting that group with vaccination, protecting your bubble, and then of course, hopefully with the public health entities and the private health and physicians continuing to endorse vaccination in those communities to really keep everybody safe.
Dr. Hawkinson, it is always a pleasure. Thank you so much for taking the time to sit down and answer those questions that our viewers have left for doctors. I truly appreciate it.
Absolutely. Thank you.
Awesome. And as for our viewers, I am going to leave you all with this live shot overlooking the Country Club Plaza. We will have a weather update as well as news updates during our 3:30 newscast and so on.